Hello, and welcome to an episode of Uprooting Passion with my brand Onestis. I'm so excited to be here with you today, Kachusha. Thank you. And today we're going to be exploring your roots and your journey into your current career today and your different inspirations along the way. So I'm very excited to be speaking with you, and thank you so much for being here.
Thank you so much for having me, Kyla.
Great. And, we met or connected through the She Rebuilds the World group. And so I thought maybe we could just start talking a little bit about that. And She Rebuilds the World is a organization for female entrepreneurs in Africa. And I had done some work with Yeva, the director of She Rebuilds the World, and got connected to this fantastic community and got to get in contact with an entrepreneur and like you. And yeah, how long have you been in that group?
I think about a year now. I did a leadership course and was added to the group.
Yeah,
And also because I'm passionate around work with women and girls, I thought it was a good platform to stay. And I've learned quite a lot from digital skills to leadership and connected with different like-minded females.
that's awesome. Yeah, I've met some really incredible women in the group, and you being one of them. So very excited to share your story. And so I know you're not in home right now. I know you're far from home, but can you talk about where you were born and raised in Zambia?
Okay, so I was born in the northern part of Zambia, which is a place called Kawambwa in Luapula province. Zambia's got 10 provinces with a lot of districts. Yeah, so that's the northern part. That was where I was born from. But I settled and grew up mostly in the central town. It's called the Copper Belt, which represents the biggest mineral that Zambia has, which is copper. So that's where I stayed most of my life. But I have stayed in different parts, and I think I still went back to where I was born from. That's where I did most of my nursing. I actually did like 10 years of nursing, and then I ran away and joined the wash sector just about 2 years ago. But still passionate about giving back to the nursing community.
That's great. And how do you feel like your early environment growing up where you did in northern Zambia maybe shaped your passion for becoming a midwife?
Okay, so growing up, I was always the youngest person and I was the smallest. So I didn't really know what I wanted to do until later on when I was in my late teens. I wanted to do something around computers, but my dad was always, you're going to do something about nursing. And well, in the African culture, you always respect your parents, and even career wise, they'll dictate what you want to do. So, my fear with nursing was that you have to be a good person to be a nurse. Like, you can't afford to mess things up because the people that are sick really need you smiling 24/7. But I think it still worked out well. So I'd always seen sick people, I'd always seen vulnerable people, and it felt like it's the right thing to do, though I really just didn't know what to do, how to do it. I think, and when I was young, I had a suit. It was a small, tiny, weaved, white top and dress, and everyone would top and skirt, and everyone would tell me that you're gonna be a nurse. I didn't know what that meant, but I think it's those conversations that just framed who I later became. And I got to love the work after just joining nursing school because I had to leave and be part of my profession, even just before joining like full service. So with that and being told that my great grandmother was a midwife made me pursue midwifery after doing the general nursing.
And it's interesting you mentioned that your father had a great influence in you becoming a nurse. Tell me about your dad and on your upbringing. Was he tough or very inspirational?
Wow, that was, I think we always joke with other friends, like our dads were really, really tough. Like, why were they so tough? But later reflected
Hmm.
that to raise tough women, we needed tough dads. He's a very, very good, happy soul. He's just retired. He was one of the best teachers on the Copper Belt. He used to teach secondary school. So he taught accounts and finance. So most of the people that I meet in banks, when they just see my name, they'll be like, "Is Mr. Nkosha your dad?" And I'm like, "Yes, proud to know that he contributed greatly." So he was always strict on us, especially me being a girl. He never had room for boys. He sees you with a boy, he would beat us up by then. But then this time we reflect and laugh about it because yeah, it was tough. He was a single dad because mom passed away when I was really young, but here later we married a very good woman who raised us. So at the end of the day, we had that balance, but he was really strict.
Yeah, I can imagine. And do you have any memories of your mother at all, or anything you want to share about her legacy?
Apparently, I resemble my mom. When you see her picture, you'll be like, "Aren't you the same person?" She was she was a tough woman. She died when I was 5 in a car accident. She framed how I perceive life. Like I don't take life for granted. I don't argue with people or hold grudges because I learned from her that life is so uncertain. Like 1 minute you're around, the other you're just gone. So even in my relationships, I'll be like, if the man is argumentative, keeps sad for 5 days, I'll be like, no, this is not for me. I've learned to appreciate life through losing her. But she was really tough as well, but a kind, creative woman. I think I do take after her a lot.
Yeah, definitely. And you've had a remarkable journey from becoming a nurse, a midwife, and now in other leadership roles. But I want to hear more about your experience as a midwife. And because I know that you mentioned that you did it for 10 years and it was something you really liked doing. So what was that experience like, and maybe some of the most memorable experiences as a midwife?
Great. So, being a midwife means um, you have to look out for this woman. You have to see things early because in midwifery, we don't prevent complications. You have to manage them with the right sets of skills. So even before doing midwifery specializing, I was a general nurse, but I was always passionate about obstetrics and gyne because I knew that was the heart of my career. So it was very, very exciting. And I think leaving, I even did a TEDx talk organized by the local district just to speak about the great roles that mentorship does to improve and promote midwifery practice. Because I think throughout my career, I was mentored by great midwives that helped shape my skills. I'd always been passionate about public health, primary health care. So I'd always be in the community, busy talking to teenagers, because that's also another aspect that I took from midwifery. There's the prevention side, the management, the labor and delivery, and also post delivery. But one of my exciting moments when I was able to resuscitate a baby. So this baby was born with what we would call a scale of 4 because we measure the scale from 0 to 9 for African children, but for Caucasians and white children, it's the score is up to 10. So this baby was born very low, only had a heart rate, and I was able to just use the skills, the tools to resuscitate, and the baby cried. That was my first resuscitation. I had to call my nursing officer to just tell her how excited I was. So yeah, that was one of my best experiences.
Can't even imagine. I know, like, I myself don't have children, but when I hear women talk about their experience giving birth, like, it's just something you can't explain until you experience it. And I can imagine that emotion being there in a situation like that to help bring the baby back. That's incredible. And so, what influenced you to shift into water and hygiene?
Well, I'd always hated the notion that nurses talk too much. I empathize with people because even me, when I'm sick, I just want to get better. So the thought of someone is sick and then you want to educate them when they're receiving medicine, I just felt it's overwhelming. So even in my practice, I would always focus on the prevention side, more on social behavior change and communication. So when the opportunity to become hygiene officer came, I jumped on it because I was already doing most of that work. And I think that was one of the different but attractive thing, because I think my previous line manager, who's shifted, very good woman, she's now working for UNICEF. She was surprised that a midwife would deliver prevention work. So I had a different set of skills added on, improved by the things that I'm passionate about, which is prevention. So when the shift wasn't really as strange and as difficult, it was just being accepted in the wash sector because I was a mismatch. Everyone would be like, a midwife, what do you
Mm,
really do?
wow.
So yeah, just that shift. But I think after a few interactions and people seeing my work, they'll be like, no wonder you do what you do, because I'd mastered and improved, and I keep improving on my skill around public health and health promotion.
And what would you say is, I mean, talk about maybe some challenges moving into this career, but I know you're also a great advocate for women, and maybe what have been your greatest challenges for you as a woman in the field?
I think the biggest challenge is to see there are a lot of men in the wash sector. Most of them are engineers, and sometimes they don't really have the soft sides, like they are brick and mortar. So you know that when you go in a meeting, of course, this time there's a bit of a shift, but not really a balance. So you would find that even on pictures, you'd be the only female. You have to be a bit different, try to adjust, work harder, learn more. Just, you know how it feels when you're a female. So at the end of the day, it's about really mastering the art of how do I win even in a male dominated world? But how do I still keep my feminine side so that I don't then gauge myself based on the measure of being a man? So it's been a lot of mental but also physical adjustment, because it goes both ways. So it's just knowing that this sector has a lot of males, especially on the top. Yeah, in leadership.
Yeah, it's interesting hearing you say that. Kind of made me think of maybe your upbringing in many ways prepared you to be in a field like that. You know, having a
Yes.
strong male influence in your life, you probably better than anybody knows how to walk into that room and be confident.
Yeah, true. I actually later reflected in life when I had a very challenging experience, and I had to deal with one of the leaders who was male. So I had to call dad and say, "No wonder you were strict on us. It's not a very easy world out there for women." And so having been nurtured in how to just know and manage certain situations, I think really framed and shaped me. Think that did a good job.
Yeah, absolutely. And you've founded multiple clubs. You've been recognized for many awards. Which achievement means the most to you?
I think my greatest achievement was being recognized at provincial level for infection prevention and control. That was even before transitioning into midwifery, but I won it for the labor ward because I had put in effort, which was something that my mentor, who recognized me and submitted my name, found it a bit different, because mostly you blame it on not having the skills. So that helped to frame how I later perceived life and how I later moved on to even mentor others on how to be ready before opportunities came. I didn't wait to be trained. I read more. I love reading. I was actually waiting for you finalizing a course in partnerships. So I believe in continuous development. And so that framed how I later did things, because I was recognized for the little effort. And for me, at provincial level was a very huge award for me. So that was one of them, my first big award.
I like the theme of that, like just you saying to not wait for opportunities and but just always being prepared. I think that's really big. I'm sure just in general with health, obviously, but I like that you can kind of apply that to more broad to just not wait for an opportunity. Don't wait for a crisis to break out, but to close that gap of the waiting time. Yeah.
Mm.
And mhm. How do you see your work with women in global health and youth programs creating a systemic change?
Women in Global Health has been one of the best platforms that has created allyship, more of a sisterhood, because we have a lot of women in leadership facing similar things, and we come together to reflect and see how best do we keep our feminine side while being in male dominated places. So Women in Global Health has really helped to change how I perceive things, and the gender transformation component of it is something that I get to live every day, because I feel while decisions are made for women, it doesn't amount to anything if it's made without them. So Women in Global Health has really helped to build not only my capacities, but it's helped to frame how I view things, especially using the gender lens. And mostly we get to fights that gender is about females only, but it helps to strike a balance between seeing men for who they are, seeing male for who they are, and females for who they are as well, and just shaping and framing the different sides and how women can still be relevant, and make them know that sometimes it's ourselves that make us not achieve what we need to achieve. So it's been a great platform and a great journey.
And it's incredible too to see the roles that you have with youth engagement, and you have a role as well-being champion. I think these are really great titles. And I'm also just curious, what's the hardest part about the job in general? Like the problem at stake or just other things that are challenging?
I think the biggest challenge is just having a shift. Like, I work with people, and most of the problems are behavior centered. So just seeing immediate wins has been a challenge. When you're a midwife, when the baby cries, you've won. When you see the child at 6 months walking,
Yeah.
like there are tangible results. But behavior change, it takes about a year to see. It takes about 5 years to see what your efforts have contributed to reduce disease burden, to, reduce poverty and to empower people. So just having the faith that when I wake up, what I'm going to do is relevant and it will translate into something is really a challenge sometimes, because you stretch and you're like, should I really go there?
I that's so important too, I think maybe COVID was a big sort of first time many people understood this, how, changes in global health and how solutions come to be, that it's not an overnight solution. And I think that, yeah, that's a really great thing to bring the light to bring awareness to, is that it can't be an overnight change for global health, which makes it even more important to continue to invest in it and continue to make it a priority. And how are you? I guess you sort of talked about this, but any other ways that you are fighting those challenges, or what initiatives you are excited about?
Okay. So I keep telling people that when the salary is not enough, when the indicators are not enough, Oh, not really not enough and not reason enough for you to wake up. It's the passion that keeps you going and knowing that you're going to learn something new. So there's been a lot of innovations on how we do things, especially I think in my current role, because we had responded during the COVID, like hygiene for COVID, just using different approaches, learning new things like the behavior-centered design approach, using fun tools and also using human-centered tools has helped me to just be motivated, because I know that when I just switch on my laptop, there's going to be an update on how to do things differently. WHO is bringing new guidelines. There's a lot of research, but also the change, the advancement, and just being kept on your toes, because you can't do the same thing over and over. There's always something new. So it's the innovation part that's kept me excited, and just knowing that I'm contributing to the greater good of things, and knowing that when there's reduction in disease, there's just a better state of things, I think has kept me motivated.
Yeah. Yeah, you're right. And I've heard many people say this before, just it's and I've only luckily been in a caretaker position for a short time in my life, but it's just healthcare workers are truly special individuals. That's all I can say. It's definitely something that you have to really love, because I mean, and also too, just having your health is such a blessing, and something that until you're in bad health, you don't realize how great it is to be healthy. And just healthcare workers, they are there for you in your worst times and in your most absolute worst appearance and state, and when you're most vulnerable.
Yeah,
And it takes a certain person to know how to meet that energy. So it truly is, you have to be, I think, cut out for it. You have to be a certain type of person for sure.
true.
Like you said, both that side of like your father very tough, but maybe your mother more creative and emotional. It's just
Yeah,
like a perfect balance of those things. Yeah.
true.
And what does I was interested by this title of gender transformative leadership. What does that mean, or what does that mean to you in practice?
Okay, so to me, it's the shift where we have to ensure that we prime the gender component in everything that we do, from programming to implementation, but also priority and not leaving anyone behind. It's about seeing things differently. Usually, when we talk about gender, you find that it's either there are lots of women or there are lots of men. And then when they see that there's no proper representation, they get to call in. Sometimes it's just for numbers. But with gender transformation, it's from planning, you need to be deliberate. You have to have a certain percent. You'll be like 50% should just be women, 50% men, or 40% women. And when they are present, you have to give them the opportunity to be able to also be involved in either designing, decision making. It's a shift from just the generic programming, but also moving into just this transformative part where you have to budget, you have to build capacity, and you have to ensure that when women or men are present, they have to add value to any decision and process that you're making. So it's a concept that's really good and also growing, because at the end of the day, well, we want a balance. What does that balance look like? And also seeing that we have sustainable development goal number 5 that we have to speak into. We really have to be intentional. It's great because it's from capacity to even infrastructure. Do we have infrastructure that's gender disaggregated? What does this look like? The equity and inclusion and equity and equality, really understanding that these are critical. A man and a woman are totally different, and you have to provide for them. So, yeah.
Yeah. Yeah, I think that is something that is super important, that it's not necessarily that we are equal. We have maybe some different uh, needs in many ways, or different types of capabilities. I think that it's important to acknowledge that in order to be equitable, and not necessarily equal. Um, and how do you mentor and empower young women in health and government?
Okay, so basically, I use my strongest set, which is, well, previously I used to use the nursing and the midwifery background, which at least I have a lot of authority in. But later on, I grew interest and passion around youth engagement in WASH as well. So I'm able to bridge between the two sets of skills. So with nurses, I've always been intentional around sharing information, being present when called for, speaking opportunities. But this year I was further intentional. I have started a nurses and midwives challenge where I'm mentoring about 100 nurses to be able to demonstrate what they do in the profession by giving them monthly tasks that they are able to do. And these are themed around universal health coverage, the sustainable development goals, and the different skills, but doing it creatively and fun. Over the years, I learned that when you become a nurse and when you're in this field, you forget who you are. You forget you are a poet. You forget that you love baking, you love cooking, you have other skill sets, the soft side of you that make you relevant and I think help you thrive in a kind of stress-free environment as it is. So this year, intentional around mentoring, hence having a Kachusha Nkosha Nurses and Midwives Challenge. So every year we have a Nurses and Midwives Gala, hoping to get awards for all the nurses that will participate and finish the challenge. This year, we may start off on a rough note, but hoping that it grows and be able to get sponsorship and partners to just sponsor these awards, like the unsung heroes just being placed out there for them to be praised while they are still alive, but being deliberate to track progress that will contribute to also improving the healthcare system itself.
And if you have any additional information or links that I can promote from our talk together, I'd love to see how I can put that initiative out there for other people to know about or support. And what are your long-term goals for your community or community health in Zambia?
So my long-term goals are really around creating a strong system where youths, females, males can engage and just be able to contribute through their skill sets. I'm a creative. I am still discovering what that means, but I love poetry. I love writing. I love organizing things. So just seeing that youths are able to contribute now and get awards now, because I know how it feels to be awarded, being recognized, being mentored is just something that I hope to see grow beyond just the WhatsApp group, social media, but also in person. I have a platform known as the Snack and Learn where I bring together different organizations, especially youths doing something, so that together we brainstorm on creative ways in which we can contribute to the community while sharing skills, having motivation, but using creativity to deliver this so that everyone can be able to identify with what they have within themselves that will help them do their work effectively. I think being a public speaker, always being happy and doing fun stuff helped me to navigate the corridors of nursing and midwifery, because you can't be a sad person when you're in that state. So I believe it needs to come from within. Hence, that platform is something that I hope to see grow and contribute to the healthcare system.
That's incredible. And you are definitely a great leader and person to be at the forefront of leading those initiatives. So I think that's incredible. And my last question for you is, what is the greatest piece of advice you have been given that you will never forget and you wish to pass on?
I think I'll get something from dad. Dad has always been consistent around saying, Kachusha, you are the only Kachusha. When you die, we will forget about you. So please live your life now. So with that, I have been able to harness opportunities, to be able to do things right, to be able to be present for other people, to be able to, even where I can't share finances, I would share a piece of me, which is uh, what I know. So I think with that, I have been able to live, not be alive, but to live, because there are people that sometimes you wake up, you're like, no, I'm depressed, and no, I'm so stressed, I can't do anything. But for me, even in my toughest days, on my worst days, I'll show up and no one will even know, because I believe, and I always hear him saying, when you die, we will forget about you. It was tough the first time I heard it, but when I later reflected, I realized that he's right. When people die, it's the close relatives who mourn you for a week, max. The others will just be like, my condolences. They'll forget. They won't even know the impact of that. So yeah, that has been something that I would love to pass on and tell every other girl and female, to say, you are here now, but when you're gone, the world still continues moving.
Yeah. I like this advice, and I'm going to definitely take it with me and really really reflect on that. And yeah, I guess I can resonate with that in many ways. Is just to I always try to have that integrity to show up and don't do it necessarily always for other people, but like you say, to do
Yes.
it for yourself. And
Yeah.
if you're able to do something for yourself that also helps other people, I think that's the
A
goal in
plus.
many ways too, is to make that your livelihood, is find passion helping other people. Yeah.
Yeah.
Well, thank you so much. It was such a pleasure to speak with you, Kachusha, and I mean, just really great advice, and your work is changing the world and is going to continue changing the world, and your legacy will continue to change the world and your communities. And it all started with the seeds that were planted with your parents and your beautiful mother, who instilled that generosity and creativity in you, and then blended with your father and his structure, and like what you just said at the end, to show up even on your worst day and give it your all. And that's really incredible. So thank you so much.
Thank you so much for hosting me.
Of course. All right, so I'm going to stop the recording now.